Immune effector cell-associated HLH is a very interesting and trending topic right now. It's sort of a provisional entity which resembles somewhat HLH mass, which is very well known to oncologists and rheumatologists so far. Recent observations of similar cases after CAR T-cell treatment have spurred interest in what are the causes and the mechanisms underlying this process. So basically, we collected frozen samples from patients that were treated with CAR T at our clinic and developed HLH mass, and trying to identify potential inflammatory markers that could help us discriminate immune cell associated HLH from other types of acute inflammatory toxicities, and we did that by comparing specific biomarkers such as CTLA4, CD163, CD80 in patients that develop this sort of complication against patients that develop just a plain CRS or an inflammatory complication but without an hemophagocytic syndrome. So that's it. I think this is the most interesting question, and possibly also the most tough one to answer, because as I said, it's a relatively new field and we're still trying to figure out what might be the predictive factors for it. Certainly several clinical factors that have been associated with development of inflammatory complications such as tumor burden and patient prior comorbidities might have an impact on that. But what we want to understand is there are some serum biomarkers that might help us in achieving an early diagnosis to treat promptly and quickly the patient in order to prevent an unfavorable outcome.